This seminar is all about you. And it's for you, it's for the technicians, it's for the technologists of India and outside. All of us who want to grow, who want to become bigger. And today at NephLearn, we have some amazing speakers lined up for you. A very good morning, a very warm welcome to all of you. And we at Team NephLearn are very excited with today's symposium. First of all, Indian Association of Dialysis Technologists has been very kind and supportive, and their entire team, their patron, Mr. Jain, and their president, Mr. Sharma, secretary, Mr. Ragi, have all been very cooperative with us. And we are, as a team, NephLearn, along with IADT, we're very excited to have this symposium. And my second, of course, sincere thanks goes to our amazing speakers today. If you are as excited as I am, then you should type X in this chat box. So let me see how many X's I'm going to get today. Please type X if you're as excited as me to begin this seminar today and to hear all the speakers that are amazing speakers that are here today. Yes. So thank you for that. Thank you. Thank you, Lenin. Thank you, Nilesh. Thank you, so many of you. Thank you, Rohit Naik. Thank you, Alia. Thank you, Sirat. It's nice to see you people being encouraging like this, because it works both ways. If we arrange a symposium, we also like it if the audience is as interactive and as wonderful as you are. And with this, we will begin our talk for today. I'll just briefly tell you about the agenda, how the talk is going to be, how the symposium is going to be. So first of all, we are going to have 3 speakers. Dr. Thiagarajan Thandavan will be our first speaker, and he will give a lecture for 15 minutes on the topic of professional growth, kahan se kahan tak. And I'm going to tell you that his slides are amazing and his journey itself is an amazing one. He will be speaking for 15 minutes, and at the end of 15 minutes, we will have a small question and answer session. Many of you have sent us your question and answers through the form, and we have noted those and sent them across to the speakers also, so they will be able to answer you well. The second speaker will be Mr. Gaurav Malhotra. He's a very senior manager at NephroPlus. And I'm very happy that he accepted my invitation. Mr. Gaurav had come to Nagpur a few months ago, but unfortunately, I was not there at that time. And so I missed meeting him in person. But well, Mr. Gaurav, thank you for accepting the invitation. And our third speaker is your very own, Mr. Hari Ragi, who is in Delhi. And he's the secretary of the Indian Association of Dialysis Technologists. Each speaker will be speaking for 15 minutes, followed by a question and answer session for about 5 minutes. And so we should probably wrap up this whole symposium in an hour or so. But I have kept extra time in case you are interested. So now, if all of you are ready and we are ready to listen to the speakers, let's go ahead. And I will introduce our first speaker for the day. And that is, I hope you can see my screen. Well, yes. Dr. Thiagarajan Thandavan. He is known to almost everybody that I have spoken to, and they were all excited to listen to him. And with this, I invite Dr. Thiagarajan to share his screen. And please give me a minute. I invite Dr. Thiagarajan to share his screen, and he will now address all of us. Dr. Thiagarajan?
Yes, ma'am. I can, now I got that.
1 minute, I will just allow you to share the screen.
Yes, ma'am.
Give me a minute. So till then, would you like to say something to participants?
Yes, ma'am. So, thank you very much, ma'am, for your a great note for me, and thanks for your kind words. I congratulate NephLearn for organizing such a program for the dialysis professionals. It makes a value to the dialysis professional community. And this program, I want to make it as much as possible should be benefit to this dialysis professionals. So without taking much time, I think today is a great day for everyone on Sunday. Okay, we can hope all of you can able to see my screen. So very good morning to all the dialysis professionals and it should be a great day to everyone. So, regarding the professional growth in dialysis, especially for the dialysis professionals, a dialysis technician, or anyone who wants to understand about dialysis related things. So we will get into the point. So I am Thiagarajan. I done my bachelor's and master's, and some are related to my quality assurance, psychotherapy, and also I done my medical law also. So which helped me like go into the different career lifespan into the activities. See, the basically what I understood when I joined as a, dialysis tech, many people said you done a great mistake. This is not at all a right profession. And even after you completing your bachelor's and master's, you will be called as a technicians, or you will be called in a very low graded only. So I always feel very unhappy for what I choose. And very interesting story. I chose to only for a cardiology, that is cardiac technology. So when we went into the profession, so we were thinking about what we should do and how we can get into the improvements areas and everything. So finally, I started to, all the degrees which I mentioned, many people used to crazily, they will ask me, why you are putting this many degrees and all. All this degree which I mentioned, I didn't study based on the what I need to be in future. That means like in the beginning of my bachelor, completing my bachelor, that means in my third year of or entering into my internship, I started writing what are the degree I should get it to reach the equivalent to the doctor's level. I don't want to compete a nephrologist, but I want to compete myself to grow. I don't want to compete any of my parallel batchmates or my juniors or my students. I don't want to compete with anyone else because my competition is always for me only. I never compete other people. I never follow other people. I'll follow because everyone knows that this particular dialysis curriculum, MSc curriculum was designed by me and I got a corporate for my syllabus. So slowly I entered into the which area I should do, where I having a, because everyone will have a some area of strength, some area there will be a weakness will be there, some area there will be threat for them, and some area there will be the opportunities for them. So we used to call them as a SWOT. So I always do a SWOT analysis for my career. Where are we are weak? Where I need to improve myself? So these are the areas which made me to come to this particular level of my position. So now I am working as a senior consultant in any advanced dialysis and also manufacturing sectors, even for the government of India to do the new medical innovations. I'm appointed over there. And also I'm sitting at NABH Ethics Committee Assessor for the Central Government and the lead auditors. And these are my areas. So in our presentation, we are going to see the two areas of presentation. One is a general overview of preparing to work overseas. And introduce use. I want to introduce some of the useful working overseas resource also I need to add. So this was my patent right for my MSc dialysis. When I finished my course, then I want to say that this I took 2 years to develop this MSc dialysis. I don't want to give this opportunity because whenever I do anything, I always document it. That made me to become a clinical auditor also. Any work if I do, I started preparing the documents and I prepare my literature works and everything. So when I started my career, I always used to take photos and pictures, what I do, how I do, what is the first protocol I follow. Even servicing the machine also I play an important role, not only seeing the patients. I always do a maintenance of the machines, even I used to do some of the surgery though, even putting a catheters and everything, even though that is not eligible for us. We should not do all those techniques. But when there is no person to do this procedure, when I was there in 20 years before, I'm talking about in 2022, I was in a government servant. I used to put a catheter, subclave and everything. I was expert and trained by the hospitals. So slowly, which are the area I want to do, which are the area I should not do. I segregated myself, what I need to do, how I need to do. Right now, even sitting as a ethics committee chairman and working as an adjunct professor for many universities and doing a clinical auditor. And this clinical auditing made me to understand what are the complications are there in dialysis, which are the area we need to focus. So I created more than 350 audits I done in, especially in the dialysis, to find out which are the areas are going to be a complication and how we need to protect even for the hospital or for the technician or for the patients also. So I think there is some, so then slowly I entered into a multiple quality of hemodialysis presentation in talking in national and abroad to improve the quality of hemodialysis I was doing. This was my professional career, which I was having. Coming to the presentation purpose, we are going to see some of the, what are the overseas works we are going to do. And so in job search, generally, you will not get a job in abroad easily by the, by applying only. You need to have your own quality. What is a unique quality for you? That play a vital role. For example, if you are expert in doing hemodialysis, you should be expert in doing CRRT also. You should be expert in doing a management of your consumables also. Many people think, so what is it? Your dialysis consumable. How to use the right consumable for right patient. How do you treat the patient in a right way? By using a right consumable and appropriate thing to the patient. How you are managing the system. See, all this play a vital role when you are going for a, to abroad, because everywhere the financial concern, why they want to take you, why they want to appoint you in abroad. So the reason being you have to show your values in the system. So you have to do the additional internship, learning the extra things which is not possible in your hospital, getting a permission, and most important thing, all these things without an nephrologist you can't able to do it. So you have to talk to the, and you have to be more on working side. And most important thing in overseas or any job, most of the time my students used to ask me after finishing this job, how much I will get the salary? This is a major question for everyone. How much I will get the salary? So generally, I asked one candidate, how much you want? The candidate used to, before joining dialysis itself, they asked me, is it possible for me to get a 1 lakh? This was the thing they were used to ask. The thing is, when you are looking for only for a salary in the beginning of your career, the growth will be very, very difficult. Always think about how much you have learned, how much your career, what are the new things you have learned from professional jobs. So you have to learn as much as possible. You have to get within a period of 5 to 6 years during your start from the college till for a postgraduate or anything. Because when I was doing postgraduate, I done my 5 years of my dialysis profession. Then only I done my post-graduation at the age of 26. So to complete my post-graduation itself, it's around like a 28. But meanwhile, what I was doing, so everything I was practicing on the floor. Floor working is the most important thing to come up in your life. Because even for a bachelor's or master's, I'm telling, a dialysis is basically a simple fundamental training program. And from that fundamental training program, we have to upgrade ourselves in doing a research activities also. So whenever the doctor used to ask you to do a clinical works or doing a taking collection of data, you have to be more and more interested to do all those research works. Because when I started MSc dialysis, not for a job, it is for the research purpose I started this thing. Still, what I was started this MSc, still now also I do a research. Still now I do research in the medical device. Because dialysis related, clinical related research works are almost we are reached. Now the upgradation for the medical equipment research. That's why in MSc dialysis, we created a paper called biomedical instrumentation also. We have that particular area to understand what products we need to develop. So you have to do for a working holidays and graduate position teaching, everything you have to take, whatever the important things you want to learn in your career, you have to. So jobs in each country may follow a different process and timelines. Many people ask me, I want to do a bonnet, I want to finish by a bonnet. What is the purpose of bonnet you want to do? Is it a bonnet is going to be a added value for you to go to abroad? You tell me. That you have to understand. So which are the areas are open also, I will tell you. Which are the countries or opportunities are open. Most important thing is, even Thiagarajan is sitting in India. He didn't go to abroad. Why he didn't go to abroad? He may not got the job in abroad. No, I got the job in abroad. When I was working in Andaman, I got a job in New Zealand. I have to supposed to join within a week. I have to say yes to them and I have to move to the country within a month. But I could not able to go because I was working in Andaman, where I was the one who started the dialysis program over there. I saw a lot of poor people. So my intention at that time was not to leave the people who are suffering, because they are all a vulnerable population. okay, I can earn money, but at the same time, I thought of only for my seeing the patient. Even that is a government job. After 2 years later, many people used to tell me, Thiagarajan, don't teach those people. They will, you will lose the job. I said, if I'm teaching the juniors or teaching the subordinates, I'm not going to lose anything. I always teach everyone. That made me to grow in a next level and next, and I never hold my position always with me. I always used to give my responsibility to others also. This will help you to go to the next level. If you want to hold all of you in your own control, you will not grow. When you want to grow, you have to dedicate your responsibility to others. Then what is your responsibility? You have to go higher. You have to see what is the next opportunity you are getting. So resource, and you are, when you are going from country by country or information or work permit you want to do or resume writing, you should be good in writing those things. Employment trends are there. When is the opening is going to come? Everything you have to look into the website and you have to collect the data. And most of the time here is many professionals who are going out of this country, who are going and settled in abroad, they have their opportunity. They can share the details when the openings are coming. It can be done with your, a lot of groups are there. They can share the data. Most important thing is the competitions are increasing day by day. So you have to create your own value. What is the additional value you created? What is the additional hard work you have done to show you are better than others? So the competition is becoming day by day very, very hard. And still there are jobs are there. Frequently some jobs are coming in Middle East and Australia or New Zealand also. So these are the some of the international internship sites are there. You have to go. But one important thing is you have to get their own local country people or nephrologists who can able to accept it. Why they want to accept you as a graduate or why they want to take you as internship, you tell me. You should prove yourself that I done well in India. See, if you are a skilled workers, if you are working as a skilled workers in India, if you want to go to abroad, the same skilled workers there also. What is the additional value for you to more than a skilled workers if you're going to join in abroad? So those things you have to add. And whatever I'm mentioning here, international job search and data and everything, this is it is a non-exhaustive the list of types. Our company, my Tides Institute will not say as to you have to see this many openings are there. But are you get a job in USA? It's question for dialysis profession because it's very difficult in US or in European countries. It's very difficult. Unless until you have a unique value in your system, then you can apply and go. So for everywhere, there is a separate exams are there. If you want to go to Middle East or if you want to go to any countries, you have the interviews and everything is there. So only thing is you have to form a good network with the international teams who can able to give the opportunity, job opportunities are coming, who can where you can able to participate and go there. And the most important thing is that even in Indian scenario, also there are a lot of job opportunities are there. But for that, you have to be more and more intelligent to make yourself upgrade yourself. If you don't want a pain, if you don't want anything like you want to work for 8 to 4, the stagnation of your growth will be stagnated in one particular level. You should have that opportunity that there will be a very hard work and you have to experience yourself across the India means you have to travel and you have to attend many cases. So when I joined my profession, I never had that, I got that opportunity to travel across the India. Even though I don't like to travel, I was a day scholar, wants to work from the day from 8 to 4. I never thought I will go to MNC company and join and then I work over the MNC company. Many people ask me, you are a fellow who is a professor in your way, why you want to come and do this working with MNC and all. I joined MNC, it's for my own purpose. I know what is the purpose of joining in MNC. I want to learn some new things. What are the advanced equipments are going to come in India, Indian market, where we are focusing, where is the growth of India. And we all dialysis professionals are there in this Indian region. The purpose is to serve the vulnerable population. That is your dialysis patients. Even if you go to abroad, you are going to serve the vulnerable population of dialysis patients. How much you are going to give the benefit to the community? Because we are all are working for some human being. You think about whether whichever the department you are taking. So you have to think about how you want to estimate, like a networking system, where and all you are getting advertisement for your job and everything you have to look into. So there are offers are there in multiple locations. Visa process, what is a visa? Are you having a valid permit, passport, and everything? So these are all in your secondary level of your moving to your career growth, you will be looking. And most important thing, you should have a minimum finance to handle your growth. Because most of the time, what happens is you may not uh, uh, so you may not have that plan like ticket booking or some amount of. So you should have some amount of finance regularly whenever you get the offers to move without any stressful over there. Because most of the time with the stress, if you're going to abroad, you cannot able to attain at all. You can't able to get anything over the professional growth at all. So you have to be very relaxed when you are working in abroad. So regarding the accommodations and everything. So the first thing is category is you have to find out a right opportunity for your system. And regarding your finance, we were discussed, and your regular account maintaining, and even for getting a visas, or sometimes they will ask you what is your financial stability in your accounts also. So each and everything play a vital role when you are going. So living abroad is like living and working overseas can be a rewarding or confident building, but it requires a great deal, and preparation can be a challenging also. And the opportunities are there with the New Zealand and global opportunity. You have to look into the thing. And going to the Middle East, you have to be very clear whether you are going to Abu Dhabi or you are going for a for Dubai, or for all these things. You have to have the Minister of Health, and especially you have the licenses that required. So there will be the regular Viva and prometric exams they will be conducting to get into the this type of thing. But you should have local people who are sitting in your Middle East. You should have those details. So with this, I want to finish my presentation. So if you have any questions, I can able to answer rather than I'm talking. Thank you, madam.
Yeah, thank you. So what we will do is, I think we will just I think what we will do is we will take all the questions at the end of the seminar, because there are many working professionals I know, I can understand. And maybe Mr. Gaurav has already, or I don't know, Mr. Ragi also might already be engaged in some other activities, and many of the participants also. So we will take all the questions at the end of the entire symposium. I thank you, Dr. Thiagarajan, and thank you very much for your wonderful inputs. What I can personally take away is never stop learning. Whatever your position, whatever your age, learning never stops. I have seen so many technicians who tell me, oh, now we have 8 years experience, 20 years experience, 5 years experience. I don't need to learn anymore. Sorry, that's not allowed. That Dr. Thiagarajan is a living example of this, that you should never stop learning. You should never stop working hard. So we will now move on to the next speaker. Dr. Thiagarajan, can you stop sharing your screen, please? Yes, great knowledge, Mr. Irfan. Thank you so much. Yeah. So now we move on to our next speaker. And again, this is somebody who you should know, is Mr. Gaurav Malhotra. Mr. Gaurav Malhotra is not known to many of us because he is a quiet worker. I have seen and observed him only on LinkedIn. He is an amazing person, and the kind of posts he puts up on LinkedIn, I think all of you should follow him on LinkedIn, because that's where I came to know about him first. And then I was curious about knowing him. I reached out to him and messaged him on LinkedIn. And surprise of surprises, he did come to Nagpur on behalf of NephroPlus. As I had stated earlier, I was unfortunate. I was not there in Nagpur, and therefore we could not meet face to face. But I'm very, very happy that he's here as a speaker. He has 14 years and more in experience in the dialysis industry. And currently he's working with NephroPlus in a very high position. But he has earlier worked with even 7Med India, and he has worked with Religare Technologies and Fresenius companies, all A+ companies that we know of. And those in dialysis definitely know these Fresenius, 7Med, and all these establishments. And Nephro Plus, of course, is not new to any of us. So I welcome Mr. Gaurav Malhotra. And with this, I will share his screen, his PowerPoint presentation. Yes. Mr. Gaurav Malhotra, over to you. You can start your talk.
Thank you, Dr. Ashwini, for a wonderful introduction. And probably next time I'll be in Nagpur, I'll first of all meet you first.
Yeah, please do. Yes.
I guess after seeing Dr. Tyaga's presentation, one thing came to my mind. I guess we all have seen Three Idiots, and that there's a Hindi famous dialogue, "Kabil bano and kamyabi jhak maar ke piche aayegi," and that is what probably is Dr. Tyaga is the living example for the same. We just have to work diligently for our patients in the dialysis industry, and probably you will have, nobody had thought probably 10 years back who as a dialysis technician can grow and what's the future beyond the hospital. But probably Dr. Tyaga has broken up all those shackles and probably have given us the light that a lot can be done. And yes, probably from an industry point of view, a lot of reformations are happening, and this industry is growing a lot. And quickly coming back to the same thing, I guess if all the dialysis technicians are hearing me out, I guess this is a logo that probably you all have been seeing. Are you aware of it? If you are aware of it, please type A in your chat box so that I'll get to know that you are listening to me. Do you know this logo? I'm sure that probably most of people have been dealing with this panel a lot. Right. So yes, people are responding now. It's A, Ayushman Bharat. So I guess we all have been touched by this particular TPA, and I'll tell you, this is a game-changing government scheme, which is touching a lot of aspects, which probably I'll say 10 years back, people were like, will not be able to sustain in this industry, or this is not growing. There were patients in the market. The point is they were just not able to sustain and live through it. But this game-changing Ayushman Bharat scheme has helped us to cater for important A's, which I probably have broken down into accessibility, affordability, awareness, and assurance. So talking about the first A, accessibility. Earlier, people probably, Dr. Ashwini, just let's stick to the first one. Yes. So earlier, if I talk about the accessibility, the patients were not able to get the dialysis facility in their neighborhood. They might have to travel to the main tier 1 cities or probably the major hospitals. And generally, those hospitals also have 1 or 2 specific machines with them. And the cost of affording this treatment was also very high. However, with Ayushman Bharat, now each and every hospital has been able to get this facility in their premises. And that's where this boom and this probably the dialysis industry that has been growing because of it is on the next level. If I talk about the second A, which is affordability, we all know this is a rich man's disease. Not everybody can afford it. But with Ayushman Bharat, even now a common man can afford this treatment and can live for ages. Earlier, we get to know, I still remember in my family, there was one of my relatives which faced CKD challenges, and we just got to know that kidneys got failed, and everybody started and counting his last days. It could be 1 year, 1 month, or 2 months, or 30 days, whatever. But with this affordability factor coming into the picture, now they can live the treatment. It's a lifestyle disease. It's just the affordability. They couldn't have been able to get that access to the dialysis treatment, if I talk about. So this rich man's disease quote is now has been broken down with this Ayushman Bharat. If I talk about the third A, the awareness. So yes, since everybody is aware of this Ayushman Bharat now, and government spending a lot of effort and putting efforts in this sector, a lot of people are now able to understand that yes, there is a facility that they can avail. So awareness is also there. Also, hospitals are being pushed by the government authorities to make sure that people should be aware of this facility. And if I'll talk about the last part, the assurance, this is something basically they push for the quality I'll talk about. So Ayushman Bharat is just not mere probably another TPA or a panel probably which helps in giving the affordability, but yes, assurance that a quality treatment should be provided to a dialysis patient, the end consumer. That's what Ayushman Bharat has done. And with this, if you talk, all the hospitals, when they have this Ayushman Bharat in place, I'll tell you, this is a game-changing scenario where now a lot of people are able to provide the dialysis facility in their hospital itself. So now what you say, how as a dialysis technician, this will help you. So when there is more competition in the market, when there is more facilities available in the market, a lot of employers will gonna reach out to a quality dialysis technician. And when the competition is high, people want to stand out. And how you can stand out? When you are different, when you are giving the quality, when you are pro patient care, if I'll talk about. So as a dialysis technician, it's our responsibility that we have to uplift this thing. So coming to my next slide, if Dr. Ashwini can present that. As a dialysis technician, we have only two options available in front of us. One is that work with the hospital, and second is to work with dialysis chain or a standalone unit, because that's the future. Dr. Ashwini, I guess we all cannot see the slides.
Actually, I've been confirming, so people are telling me they are able to see. And
Okay, yes, now it's
again,
there. Now it's there.
yeah.
Yeah, correct. So
Yes,
as a dialysis technician, we have two options available with us. To work with a hospital, and to second is the dialysis chain. So if I talk about as a dialysis technician that you should work with a hospital setup or with a dialysis chain or a standalone units, I'll rather choose the later one, because that's where the industry is now moving to. In hospital setups, yes, you can probably have an entire bouquet of services there altogether. But from a hospital point of view, just try to understand. For them, it's just mere a dialysis facility. And if you see the cost or probably the revenue, if you see on the every bed a hospital generates in comparison to dialysis, I guess we all know the answer is very clear where the hospital will gonna end up with. So this has resulted in the chain of centers or the specialized standalone units to come into the play. Even if we'll talk about the international standards, you see there are hospitals who have like 200 bedded dialysis hospitals. One of the recent one is that NephLearn has opened a 200 bedded dialysis hospital in Tajikistan. So the idea is that's where the industry is moving. And international, if you see abroad, there are a lot of hospitals, those who are foreplaying on the same platform. And with this Ayushman now coming into picture, the affordability is there. Standalone has been acknowledged as a separate entity. NABH is there. As a dialysis center, you can get NABH accreditation also now these days. And that's where the industry is moving. And from a dialysis technician point of view, I guess you have to just sharpen your skills. So coming to my next slide, the options probably you have is like in hospital, you might become a clinical in charge at the end. However, working in a dialysis chain, there are a lot of possibilities that open up at your table, which can be a quality manager, a trainer, a transition guy who helps set up a new center over there, or probably you can go to our international units and can easily be deputed there, where the company will gonna help you, because these standalone units are expanding to a next level. So from my perspective, if you talk about where the industry is moving this way. Standalone is the future, and Ayushman is the game-changing key instigator to this, because if you have to provide quality, you have to make sure that you stand apart. And with good quality technicians only you can beat this. And that's where this education, upgrading yourself to next level, beat anything. But just if you will not be able to stand out, there are 100 other who can replace you. So that's my suggestion to you all is, thank you, Dr. Ashwini, for giving me such a platform and to help me share my views, what I think about this industry and how a dialysis technician can excel. Thank you so much.
Yeah, so I've unmuted myself. I'm sorry, everybody, and especially Gaurav sir, that some of your slides were not visible to the participants. I'm really, really apologetic about that. So, but we will be sharing the slides and the recording very soon, and hopefully we should be able to. So now let's go on to the next speaker, and I will be telling you about our next speaker. That is Mr. Hari Ragi. Mr. Hari Ragi, I came to know very recently about him and met him and interacted with him. And I was impressed by him, his personality. Again, a very humble person that I came across. And surprisingly, he has a lot of experience as a dialysis technologist. He's as interested as Dr. Thiagarajan in the progress of dialysis technicians. And he was telling me how their organization, IADT, that is the Indian Association of Dialysis Technologists, helps the smaller standalone units, technicians who are working there by taking small upgrade workshops or symposiums or CMEs for them at a local level. And I was really impressed by that, because that indicates that you are truly interested in improving the quality of technicians and their knowledge base also. Currently, he works at RML Hospital, New Delhi, and he is the secretary. And he was very successful in organizing the IADT Con in 2018 in Raipur. He is also faculty in various universities for dialysis and has also worked with various agencies and given publications at a national level and attended several workshops and CMEs. So now I invite Mr. Ragi to share his screen and begin his talk.
Thank you, ma'am. Thank you a lot for introducing with the great words.
Yeah.
On behalf of our association, I am welcoming all the participants who are joined to this program. Just let me share my screen. Myself have to do, I think so, no, ma'am?
Yes, sir.
Just, okay. I hope so everyone is able to see my screen.
Yes, we are able to see.
Oh, correct. Thank you. Thank you. Yeah, as just now we have listened the slides and excellent lecture by our Dr. Thiagarajan sir about the growth of a dialysis professionals who are coming from a dialysis as a dialysis technician. And from our Gaurav sir also, Mr. Gaurav, we have seen that dialysis professional require the quality patient care they are delivering and the industry growth. These all the things are linked with what I think so, the conduct of a professionalism we require for the dialysis technologist. Because which I have seen through 2.5 year decades, from a 2.5 year decades, I'm in this field from 2001. I've seen a lot of changes in the conduct. Because when we are doing the dialysis during that period, that period is totally different if you compare to this current period. Because how it is came to know means, as I'm working at a ground floor only right now as a dialysis technologist, a senior dialysis technologist with a central government hospital. But beside this, because of the fond of teaching and to professional growth, I linked with the association, I linked with many institutes as a faculty. When I came from a south, actually related to the south, from Hyderabad, I have completed my course. From there, for a job purpose, I came to New Delhi, where I have joined a central government job. After that, I'm continuing for my courses, but I'm not satisfied with my profession. That's why I have interested with the teaching level. That's why, because at that period, we don't have any that much of colleges nearby in our area. So that I have received a PG diploma in dialysis technology. After that, I have completed my MS in psychology. That is the not dialysis field, but is related to somewhat with the professional. That's why I gone through that. And when I came to North, it is totally different scenario what I have seen, because it's a very few colleges here. As they are getting the certificates or diplomas, and so many people are entering into the field directly without any qualification. Also, what I have seen here, as we know that the key responsibility of dialysis technologists, they used to do the dialysis, operate the machine, and how to operate the machines, and the vital sign of the patients, and to face the complications of the dialysis, complication related to the technical or the clinical. And most of the people, this much of are only learning from the ground level, as without any qualification, what I have observed in 2006, 5. After that, it is the scenario is changed. So many colleges are opened in the north area also from the 2010. But during that period when I'm working from 2006 here, I have got an opportunity for as a faculty in universities and institutes. I have gone as a guest faculty at that area. What I have seen that's lacking of the professional conduct with the students. They don't know about the ethics and the conducts. Without these two things, as dialysis professional or any healthcare worker, we don't get any growth in our field. We don't have any growth. We require something of fond of our profession, first of all. Some enthusiasm, zeal we have to keep. We have to show something towards our profession. These are the things that so many people are not interested. They want a time fixed bond. They will come for a time, and after completion of their duty, they have to leave. And that's it. But they don't think about the ethics or professional conduct. These are the things there it is lacking. I don't know why it is lacking, because of the curriculum which is using by the university's own curriculum they are developing. And we don't have any unique curriculum which I have seen during this period. As we know, the profession introduction means why uh, this conduct is required to the patient as the individual behavior and the responsibilities and the professional ethics. In every profession, it is required actually. In the system rules and the principles, whatever it may be, every profession, a professional or employer, it will affect. He will be expect these all the things from a employee. Main the definition of the ethics as the principles of conduct governing one relationship with others, basic beliefs and about right or wrong. The code of ethics, we have that carrying out responsibilities in manner consist of with the quality, care, and ethical obligations of the profession. These are the things we have to go through this with our professional competencies, skills, and this is also very, very important for every field, like as a healthcare worker or in any other industries also. Main the principles of ethics are the autonomy, beneficence, and the non-maleficence and justice. We will go through these slides. Like autonomy is called a freedom of choice, accepting the responsibility of one's choice. When the patient came out to you, you have to listen, humble the problems, what he said, and we have to respect these all the things. But in between, so many people are not learning from their ground level. But as when introduced to these PPP model industries, like so many third parties like PPP, like NephroPlus, Apex, and so many companies are there like that. They are keeping a one scenario and one implementation of these all the things to the people who are not came through these professional conducts. Because of that, so many people are so we are seeing that change nowadays. Like beneficence, the beneficial principle states that the actions one should take be an effort to promote the good to the patient's main thing. And it requires the balancing of harms and benefits. We have to stick to that. We are not going to do any harm to the patient, and what we are doing, there's a benefit for the patient purpose. And the normal case, it will be states that the harm means emotional and the social as far as physical injury to them, because everyone is the vulnerable patients. We know that when we came to us. And ethical principles and versatility, it means that obligation to tell to the truth to the patient. We should not keep in a behind without telling anything as a like Jude. We should not share with the patient what the reality. We have to tell to the patient what is going to the during the procedures, how we are doing the dialysis procedures. As we are doing the dialysis, definitely we have to explain to the patient this is the procedure, what we are going to do, and how the complications, what you want to face. These are the things we have to explain to the patient. And just it's concerned that the person should be treated equally and fairly. We should not give any preference to one patient. He is my family member, or any other patient is specifically, because main in this field, what I have seen that so many patients are in contact very deeply with a dialysis technologist. When he used to come regularly, he used to say that, no, I want that technician to do this dialysis. No, I will prefer that technician, and during that time, I want a slot. These are things we should not go through in our professions. Everybody is equal to the patient, and we have to treat same thing also with them. Fidelity, it's keeping one's promise and commitment. The principle of fidelity holds the person should faithfully fulfill his duties and obligations. Faithfully, we have to work with our staff, or with our colleagues, with our organization, or with our patients, which will make you growth in our professional also. Like confidentiality is very, very important. If patient will be share so many things with us as their personal information also, and we have to make it as a confidentially. We should not share with anyone, even in our family also. We should not share anything. That we have to maintain a confidentiality with the patient. And the purpose why we are making the standards, because the behavior of healthcare worker provide the general guidelines, and healthcare worker come into that action. We have to show what is the distinguish between the what is the right and what is the wrong thing. Everything we have to know main in this profession. And these uses that rightful places and the individual in the healthcare, the delivery system, and it contributes towards the empowerment of the individuals to become responsible to their health and well-being, and it contributes the quality of care also. It identifies the obligations in practice, research, and relationships, and it informs the individual families, community, and other professionals about the expectation from a healthcare worker. When you used to came for the that scenario is totally different from the private sectors and the organizations as a PPP models and the government centers also. What I have seen, the so many centers are there. But nowadays, the government centers also, they are becoming NABH. NABH implementation is very, very important for everywhere. What I've seen that the professional conduct is also they have included in this. They are setting the feedbacks from the patient, how the staff is behaviors. These all the things they are taking. There is a good initiation in our India. Like ethicals, if you go through the ethicals, we have so many things are divided into ethicals, like professional behavior, integrity, objectivity, professional competence, confidentiality. Like if we talk about the professional behavior, it's a way of exhibiting the politeness, respectful, accepting the duty heartfully, and behave like a professional manner in the workplace. Wherever the patient, when the technician is reached to their duty, and we have to accept duty heartfully. We should not think like that. I came for the 8 o'clock. I have to leave by 4 o'clock, whatever it may be the duty timings. We should not think like I am coming. I am from 8 to 4 my duty. No, heartfully we have to do our duty. We have to deliver out the things, and thoughtfully we have to do our duty. That will be give the professional growth recognition for themselves also. Always use the title name before the patient names unless they have given permission to use their name first. Definitely, we have to call any patient or any our colleagues also with using a title like Mr., Mrs., whatever it may be. Like doctor, we have to give use the title. We should not go directly by calling their name itself, and we should not use their nicknames which are using at their homes. They will feel like a dependent. We use title with the other staff persons, especially when we are talking to them in front of patients. We have to respect our staff also. Most of the seniors, what I have observed that they used to scold the juniors in front of the patient. But the juniors feel that very heartbreaking things will be happen when he will come for a changing room or in his area. He will share the things that it is not good. Like if anybody scold us in front of patient, that will degrade them in front of the patient. The respect will not get. Yeah, another time he will not accept that technician to get the treatment. These all things will be we have to make into the concern, and we have to think about this. And seniors little bit we have to give our professional before in the junior level also. Like we say thank you or please to all patient, other staff and visitors, other family members when it is required. And the professional responsibility and it is accountability also. It appreciates the sense of self-worth, and it nurtures it and carries our responsibility in the framework of the professional boundaries, and is accountable for maintaining practice standards, and is accountable for own decisions, actions, and compassionate. Is responsible for continuous improvement of current practices, like provides adequate information to individuals that allows them informed choices. The patient used to freely, he can also share the things what is happening with him and what does he require, the treatment modalities. He will also use to really, he can share with you also. Be active in developing the career professional knowledge through the professional organization, like participating, establish and maintain the equitability and the social and economic working conditions. We have to be active in our professional growth also. When I used to make some meetings in the small meetings, small gathering of the meetings to explain these all the things, I have shared like this. Just I have, we are seeing that today our participants is registered around the more than the 510 like that. But how much they are interested to joining this class, that I have seen last that around the approximately that is 100 people have joined. Because that will make a professional growth and their professional interest and professional zeal, what amount they have and how they are interested about this. Because in offline also, when I arrange the meetings also, so many people they used to excuse this that I have some work, I have this thing, I have this thing. These all the things should not be happening in a profession because we have to give preference for our profession. I used to say at my home also. First, my wife is our my duty. Then the second wife you are my home. First, we have to give the much of respect to our profession. Then only we have growth and practice within the framework of ethical and professional legal boundaries and follow the practice of codes, ethics, the conduct code of professional conducts which are inbuilt. And they should be familiar with the relevant laws and the practice accordance with the laws of the state. Because here we are lacking that we don't have any council till now. But recently that in 21 in Rajya Sabha we have passed a bill that we have National Commission of Allied Health Professionals, but is not implemented in every state and it is not up to the mark currently also. It is lacking making that much of professional conduct and these all things will be maybe I expect in future everything will be implemented and we have come the good days to the patient and the organization and professional behavior also will be changed by these all the things. Always obliged to work harmoniously with the members of the health team and appreciate the team efforts. If any junior have done something hard work or is doing OT, extra duty also, we have to appreciate the team always and cooperate the coordinates and collaborate with the members of the health team to meet the needs of the people, that is the patients. And the integrity we have to work, promote the environment in which the values, customs, and the spiritual beliefs of the individual are respected. And dialysis technicians share the society the responsibility of initiating and supporting action to meet the health and social needs of the patients. And main thing, we have to dress appropriately for our work, groom appropriately, including the nails, hair, makeup, jewelry, so many things are considered into the professional conduct also. So many people used to come with the nails and they will not groom properly and they don't make a dress properly in civil dress only they used to work. But if we are in a professional image, we have to accept these all the things and we have be professionally like that. And we keep noise level quiet peacefully in front of the patients or in our staff. We make the patient as comfortable as possible. The professional competencies, like maintain the competencies are to render the quality of care. Quality of care is very, very important. We have to professionally being in a skills and competencies we have to improve that by avoiding that we do not keep the patient waiting without explain the delay. If anything is delayed without technically problems is there means definitely we have to explain the what's the problem today machine is breakdown or anything is happened with us. So many things will be happening in our daily life. That thing we have to share and we have to make feel them that professional. And we should assure all equipments are functional. Get ready the equipment when the patient arrives without any delay. Before patient arrives on a bed, we have to make it ready the machine and we have to keep everything disposable consumables with the ready with the patient and we have to make sure that the patient care area is clean and free from the blood. We have show up work on time while we arrive, we ready to work and provides care in accordance with the set standards of the practice and treat all individuals and families with human dignity, providing the physical, physiological and emotional and social and spiritual aspects of the care we have to go through and respect the individual families in the context of traditional and cultural practice. Ensure the safe practice is very, very important because during the priming and when we are doing the reviews, safe practice we have to keep there because they are dependents upon us as that much of we know about the technically as doctor and or any other healthcare worker don't know these all the things. We should not lack it. And present the realistic picture truthfully in situation for facilitating the autonomous decision making by individuals and families. The confidentiality, we have gone through this slide lastly also. Same thing, we should not discuss the personal life and we should not discuss the patient inappropriately. And no dating with the patients or staff and hold confidence, the personal information, use judgment. And so many dialysis technicians I have seen in the last decade that they make a good relation with the patient, and some patients and the technicians will be uh, go together. These all the things should not be come in the practice as a professional. You have to keep a relation boundaries like this. And communication, interpersonal relationship, you have to maintain uphold the dignity of your team members and maintain effective interpersonal relationship with them, and respect the individual's right to privacy and maintain confidentiality and shares information judiciously. We have to work and keep on going, continue education. Very, very important. As very happy that so many people are registered and so many people are joined. In future also, they will see these all the slides by online, which will be updated by our team. And ensure that utilizes all the opportunities for self-development. It's very, very important, as Dr. Thiagarajan told in the first lecture, that is the self-development. We have to make that. We should not think about the organization, what is doing for us. No, what ability you have, that much of you have to implement in your profession. It will make you grow. That profession will make you growth. We objectivity, if we talk about the objective, we introduce ourselves to new patient. When the patient is came to our unit, we have to introduce ourselves. This is happening in the corporate centers which I have seen. First, they will introduce themselves, what is his name, what is his profession, these all things, and ensure that the individual receives the sufficient information on the basis of consent for the care and related treatment. Everything we have to explain to the patient, and we have to take the consent and respect decision made by the individual regarding their care, and something will be informed to you by the patient and their attendants. As I've gone through the so many material is there on online nowadays, we are it's available. Before coming to our unit, they will have some minimum knowledge about this all the things and what the treatments are going on and what is the expensive they will get. These all things we have to explain in a good manner to them. And value human being. As a human being, we have to value a human being. Definitely, we should not harmful unethical practices, and encourages and support individuals in their right to speak themselves on issues affecting their health and welfare, and respect the support and choice made by the individuals. And what the beneficiation of the professionalism? As we have gone through these all the slides, it will make us a personal growth meeting. It make us good, feel good, and importance of our job, keep us in limits, and it build confidence us. If we have done good means, always our heart will be say that we have done a good work. It will be make a positive sign for also, and it promotes mutual respect between staff and patient and staff to patient to staff. And it promotes the supports independence in patient rather than the dependence, and we know where we stand and where are our boundaries. We have to know first of all, and it makes the patient feel all respected also, and it provides care for individuals without consideration of caste and religion or culture, ethnicity and gender, socioeconomic and political status, personal attributes, or any other grounds. We should not care that as individuals, and we have to provide the care considering the benefits and values of cultural sensitivities, and develop the promote the trustful relation with the individuals. And the professional advancement is it contributes to development. It will make determine the implementing of quality of care, always updating our own knowledge, and it contributes to core professional knowledge by conducting and participating in researches. The healthcare worker carries personal responsibility of their practice for maintaining competencies by continuing learning. Continuously, we have to participate in these CMEs and education programs. Like as Madam is introduced, NephLearn is a very good platform. You can know so many things through that. In future, we are also the part of that NephLearn also. And the healthcare workers at all times maintain the standards of professional conduct with reflect well on the profession and enhance the public confidence. And technologically, they have to increase their skills and scientific advances and compatible with the safety, dignity, and rights of the people. And maybe this last slide of mine. Ensure the appropriate allocation and utilization of the resources. Participate in supervision and education of students and other formal care providers. If anybody came to our unit, we have that much of capability to explain the what treatment we are doing, how it is going to get in most of the institutions and in corporate hospitals. So many people are come for the visits, like students, in nursing students or any other different type of doctors also will be come to our area, and they are very eager to know what the dialysis, how it will be get done. We have that much of capability to explain the treatment, what we are doing to the patient, and what the principles are involved in this our dialysis field, like facilities conductive work culture in order to achieve institutional objectives, and communicate appropriately using the channels of communications, and participate in performance appraisal and evaluation of the professional services. It is doing by so many organizations. They used to give the month of the best technician of the month and best technician of the year, like that. This is providing and is encouraging by all the organizations, and works with individuals to identify the needs and funding agencies for resources allocation. Some people are not affordable. We have to go through some NGOs. We have to contact how the patient will be get economically dialysis, how we will get. We have to refer to the patient to the any government setups if they are not afford to get the treatment. So all the things we have to make a good friendly relation with the patient, like professional behavior, we have to get it done. Like thank you everyone for spending an valuable time.
Thank you, sir.
And last word I want to say that always as a dialysis technologist, please think beyond the boundaries and break your comfort. Break your comfort zone for a shining star.
Wonderful.
Every technician want a comfort zone. He don't want to hard work. We think for the minimal things. Who only he want that minimal things. If he get something, a basic thing means he is very happy for that. But always we have to think that for our growth professionally, and we leave this comfort zone. What I used to say.
Wonderful,
Thank
sir.
you,
Wonderful, wonderful. Thank you so much.
thank
So
you, Doctor. Thank you.
we have had so many speakers today, and I'm very happy because all three have brought out a different aspect of how a professional conduct of a technician should be. Dr. Thiagarajan updated us on how learning never stops. You have to keep upgrading your own self first. Then only somebody else will believe in you and give you that 1 lakh rupees as a job. So this is the first take home. The second take home I found from Mr. Gaurav Malhotra, that there are boundless opportunities. It's for you to be in the right place at the right time and in the right manner. And this has been expertly pointed out by Mr. Hari Ragi, how to come about and how to develop oneself as a professional technician. So people are going to believe in you and trust you and give you the floor, give you the opportunities to grow. If you believe in yourself, you grow yourself and you express yourself differently, think out of the box, like Mr. Ragi has just shared with us. I'm very happy all three speakers have delivered wonderful, amazing performances. Their talks have been very motivating, I think. And if you also found it as motivating as me, type M in the chat box. I would love to see a lot of M's here. It's a form of saying thank you to all three of them. And in the meantime, I will share the screen and the questions which have been asked. Let me just share the questions. Yeah. If you can see the questions now, let me ask them one by one. So there was a question from Mr. Prashant that what are the future opportunities for dialysis technicians to explore and grow more? I think Dr. Thiagarajan, if you could answer this question. We will take very
Yes,
few
ma'am.
of the questions because time is not permitting us. It's already 11:07 p.m. AM. And I think we will have just about 10 to 15 minutes and take about 8 or 10 questions only.
Okay. Yeah.
Yeah.
So coming to, I would like to say congratulate to Mr. Hari and also Mr. Gaurav. So both of you done a great presentation, sir.
Thank you,
Thanks.
thank you,
I
Doctor.
think it is very good for the community, for the dialysis professionals. So coming to the, what are the future opportunities for the dialysis technician to explore and grow more?
Yes.
See, it's not only a hemodialysis sector where we do the hemodialysis. We have a home hemodialysis projects are there. And there are many medical industry who wants to do more research on the medical device products are coming up. And even MNC, the multinational company who are in Indian scenario, they want a highly qualified professionals to practice, to train the people and all. So they can go into any sectors. Even the peritoneal dialysis, still it is in a very challenging phases. But I feel that in the near future, India will give the report of PDSFS policy. One day it will come. There will be a huge opportunity for the peritoneal dialysis. Even I am fighting with the multiple time with the state and central government to develop the peritoneal dialysis. Why the PD is not growing? So even for that also I'm fighting. So there is a more opportunity for the dialysis professional. They can practice very well and they can take care of the community that our Indian vulnerable population. Yes, ma'am.
Thank you, Dr. Thiagarajan. Mr. Gaurav Malhotra, there is one interesting question about public-private partnership models. So the question is that why dialysis units are going to the PPP mode, asked by Mr. Amit. And what is this exactly? Could you give us a brief idea for what the technician could expect in a PPP model?
I guess this is something that we should take it in a positive way, and with like aims like institute now are also going this PPP mode. The reason is that dialysis is more specialized and it's a time consuming thing, and we as a dialysis technician can understand the grief of a patient, and probably that expertise, that care has to be given so that the dialysis patient can live for ages. And with that precise expertise, probably if I'll talk about PPP has to go with this private partnership has to excel,
Okay.
because the government is not core focused on these things. Although yes, in terms of the funds, in terms of the resources, they are happy to give, but the expertise brings on the table by these private players only.
Wonderful. Actually, I agree with this that dialysis cannot be only a government game. There are numbers which are growing exponentially day by day. 1,75,000 patients are already on dialysis as per a CKD global study, and which was published in 2016. And it is expected that by 2030, we will have 40% more patients. So you can just imagine the numbers that are going to be on dialysis. And definitely PPP model will be a good way out.
Yes.
Another question, Mr. Hari Ragi, towards you by Mr. John, that when we are working professionals, how should we take out the time to develop ourselves and to train ourselves further?
Then during the period, how I have done means same thing. When we are
Mhm.
doing the night duties, and we will get something little bit rest. At the morning time, during the period, I used to take the books to our area.
Yeah.
After settling everything with the dialysis, and we have to go through our subject and we have to improve our knowledge. At the patient area also, we can do that thing. After
Yes.
that, we have to give some time for 1 or 2 hours to our juniors to explain
Mhm.
you, make some simple slides, and you explain to the procedures and whatever it may be, what you are doing, make it come into the slide project, and then you can go through. Nowadays, you have online is there. You make some videos and you go through your YouTube channel, and so many people are doing the same thing also. You
Yes.
can take the platform and you will can upgrade your profession if you have found. Definitely, you can do it like this.
Yes. Or you can join NephLearn and take the advantage of seeing various courses that we have, especially this one on clinical emergencies for even senior technicians. Daily on the floors, you can see there are a lot of complications, and you can then handle these complications seeing our videos. Well, that was my prerogative, so I've taken that prerogative. Dr. Thiagarajan, next question to you. One participant, Miss Shreya, is asking that how can I become a faculty?
Okay. Becoming a faculty, there are options are only by basic. They should be a bachelor in dialysis. Even a diploma in dialysis they can become. But the thing is, they can't able to do it for bachelor people. So minimum they should have a bachelor degree. They can be a faculty. But if you want to grow in your a complete professional of a faculty and teaching and education, you should be need to do the minimum of master degree to be a future faculty and everything. Along with that, you have to have the other unique knowledge of professional development for you. That is another requirement. So this is are available in a part-time courses or NPTL you can join. But the thing is, minimum masters is required to be to become an assistant professor or a lecturer or anything you want to become. A minimum masters. PhD is an additional value. Yes.
Okay, thank you. Mr. Gaurav, one question towards you, which is slightly offbeat. There is from Miss Seerath, and her question is that what about overseas employments? So why I said offbeat is because I know recently NephroPlus has been opening centers in Uzbekistan, I think, or Azerbaijan. Yeah.
Yes, Uzbekistan.
Yes. So would you employ technicians from India or from Azerbaijan, Uzbekistan?
Okay, so yes, we are going for a good mix. So we have been in past also giving opportunities to our technicians who are working with us in India as well, and those who are well qualified and have always shown their perseverance and probably the attitude. We have always pushed them to go and spend time, and probably if they have wanted to relocate, we have given them opportunities also in past. and still looking to those who can contribute well. The only objective of NephLearn is that patient guest care comes first for us, and that attitude has to be there from within.
Yes, that is so true. And Mr. Ragi has also pointed out the same thing that, and all three of you actually have been saying the same thing, that the change begins with self. And it's only when you realize that, okay, I need to do a little more, put more on the table so that people can give me more. One question Mr. Ragi has been asked related to this, that how will our salaries improve? We do so much work on the floor, but we are paid so little. Well, I think it's a difficult one to answer, but if you could attempt the answer, that would be great.
Main thing, ma'am, actually, I have gone through so many PPP models. I used to get complaints that initially they are getting salaries, but it's not like that. They are doing good salary for the people who are having the good knowledge, good enough, that much of capable to give the interviews, and they're getting good packages. Also, the people who are getting less salaries means without any professional values or without any competencies, skills, like
Right.
that also in their market. That will be there with every field. If you see the every field, little
Yes.
salaries they are working, and with a huge packages also they are working. It will be vary from the individuals. You
Wonderful.
have to not blame the our profession.
I remember attending a leadership in action workshop, I think 15, 20 years ago it was. And the first thing that they taught us was about self. Know yourself, know your weaknesses, know your strengths, and then improve on the strengths and overcome the weaknesses. So that was a big learning for me that day. And like you rightly pointed out, your hair, your style of talking, your approach to studies, everything works. It's all about you. First, it's about you, then it's about everybody else around you. So wonderful
Dr.
session
Ashwini,
today.
just want to add to it this part. I
Yes,
have done
please.
tons of interview, and one thing I always observe that
Yeah.
technicians generally don't have their future roadmap planned. And
Okay.
whenever you talked about to them, let's say in terms of increment appraisals, or when they try to switch the job, they just want to raise their money. That's a valid point. But the point is what they have added value to themselves.
Correct.
There they go blank. They
Yes.
just want that they have
Yes.
spent time, they have experience, but the idea is learning has to be continuous. They have to invest in themselves, and also what on the table they are bringing too. So as a probably from a hiring perspective, they need to understand people want to see what is on the table that they are bringing to that company, how they're gonna change things. That is something can be a game changer, and they should always look forward to that.
Absolutely. 100%, 1000% agree with you that it's all about what you are bringing to the table. And actually, we started NephLearn with that in thought, that other than the courses, BSc, diploma, degree, something else needs to be there for training for technicians. And that's something else that we're trying to bring to your table. I hope you all enjoyed today's show. Today's show, I should call it, because these three speakers are very difficult to get. And I've been very lucky that they said yes to me and came on this show, on this entire symposium. I invite Mr. Satendra Sharma. He is the president of Indian Association of Dialysis Technologists. And I invite him to deliver the vote of thanks. Sir, we are very grateful that you are here with us. And I invite you to...
Thank you, ma'am. Thank you. Am I hearable?
Yes, sir.
Yes, sir.
Thank you, ma'am. First of all, I want to share my experience. I am Satendra Sharma. I joined as a dialysis technologist since 1983, more than 41 years as a dialysis technologist with Delhi government.
Okay.
Ma'am, I am also the founder member of IADT, Indian Association of Dialysis Technologists. And
Okay.
under the banner of IADT, we have arranged so many educational programs for dialysis technologists and dialysis nursing in the different parts of India on state level and national level. Our last national educational program in the 2003 at Maulana Azad Medical College. And you will be pleased to know that more than 550 delegates attend our conference.
Wonderful.
And more than 30 nephrologists support us as a speaker, as a chairperson. Mr. Hari Ragi, myself, and Mr. Grace was the organizer. and I always happy and I always support to anybody whenever anybody who want to arrange this type of educational program for dialysis
Thank you, sir.
technology.
Thank you. Thank you.
So first of all, I appreciate to you for arranging that wonderful and different type of webinar today.
Thank
It
you,
was
sir.
really informative and a different type. So it is very knowledgeable, and I thanks to Dr. Thiagarajan, and I am also agree with you that we should not leave learning anytime. हमें हमेशा पढ़ते रहना चाहिए। और हरि रागी से एक सवाल पूछा गया था कि हम अपनी सैलरी को कैसे वो करें। अगर
Yes,
आपके
sir.
पास नॉलेज होगी, आपकी नॉलेज आपको अपने आप सैलरी आपकी ग्रेस वो करेगी। तो मिस्टर गौरव ने जो दिया है, मिस्टर गौरव, डायलिस टेक्नोलॉजी इंडस्ट्रीज हैव मोर एक्सपेक्टेशन विद यू। आप पीपी मॉडल में हैं, बहुत काम कर रहे हैं, डिफरेंट उसमें दिया आपने, बहुत अच्छे से प्रेजेंट किया। तो हरिरागी के बारे में मैं क्या बोलूं, हरिरागी मेरे टीम के मेंबर हैं और हमेशा सपोर्ट करते हैं। इनकी जो कंडक्टिव वो नेचर है और हम्बल है। आई ऑन द इट इज माय प्लेजेंट ड्यूटी टू डिलीवर वोट ऑफ थैंक्स। So first of all, on the behalf of all participants, I thanks to you, ma'am, for arranging that wonderful educational webinar.
Thank you, sir.
From the bottom of my heart, I thanks to Dr. Thiagarajan for giving a wonderful and very attractive speech in a clear manner. And ये बहुत ही हम जो डायलिस टेक्नोलॉजिस्ट हैं उनके लिए यू आर द एग्जाम्पल। मिस्टर बजाज, थैंक यू वेरी मच फॉर यू। एंड हरिरागी, आपके बारे में मैं क्या बोलूं, ऑलवेज यू आर द member. And thank you very much once again. I request to all of you, these type of programs are very good for our dialysis technologists, especially for the newcomers, for sharing. Through this type of program, we can share our knowledge, we can learn more about new techniques, and then we can give the better quality of service to our patient and society.
Yes, sir.
So, thank you very much once again for all of you. Thank you.
We have a special compliment from one participant from Philippines. Miss Archie Besa has said that thank you so much for all the helpful information. It helps me to grow as a dialysis technician here in the Philippines. So I am really happy. There are so many thanks coming. Satendra Sharma ji, आपके लिए भी बहुत सारे thanks हैं. Thank you to Dr. Thiagarajan, to Dr. Hariragi, and Mr. Gaurav Malhotra for all of your inputs. If there was any, mishaps on our part, please excuse us and please forgive us. So with this, thanks to all of you, and we will now close the session. The certificates will be available to the participants. Please join the Google link and fill in the form with your details, and you will be getting the certificate online. Okay. In 1 or 2 days, it will take a little time to add your names specifically. So please give us some time. Thank you very much.
Thank you, madam. Thank you very much,
you.
ma'am.
Thank you, sir.
Thank you
to all the speakers.
Thank you.
Thank you, Dr.
Bye-bye.
Naga,
Thank you, Gaurav. Thank you, Mr.
Thank you, Dr. Ashwini.
Thank you. Thank you. Yes, I will stay for a little while and absorb in all your thanks and appreciation from all the people who have been here today morning with us. And I would also like to announce actually that yes, some of you are putting on your video cameras as though you're ready for a photograph. So I think I will take one. Right. So ready, get set and go. Yes, I've taken one picture. Yes, thank you so much for putting on your video cameras, some of you. And what I want to announce is that IADT has been very supportive, and we have decided to take more such programs in the future combined with IADT. Is that right, Mr. Ragi?
Yes, ma'am. Definitely.
Yes, definitely. Because
Yeah,
I think
yeah.
it's the need of the hour
We'll
where we are together in learning.
Yeah, together we will do.
Yes.
Yeah,
and I'm sure we will. Yes, Archie, thank you so much for your compliments. I can see you put on your video. Yeah, hi. So can you speak something? Can you put on your video? We would like to hear your feedback. Can you put on your audio, please? Okay.
Anyone of you, please give your
Anybody
feedback
wants
and
to
inputs.
give any kind
Anybody
of
wants to give
feedback?
any feedback, please.
Yeah.
Welcome.
It was nice having you all. Shiv Kumar, Sagar. Yes, I think you attended my live class yesterday, was it? Yes, I know you were there yesterday. You and Vincent and all the others. So at NephLearn, we have various courses like clinical emergencies. Mr. Sagar is one of the students there. And we have live classes once a week, every Saturday evening, 7 p.m. Only this week, I will be taking it on Friday. So if any of you others are also interested, you can join in. Oh, Archie is having trouble with the audio, no problem. But your message has been typed and we have received it. Dr. Thiagarajan, would you like to add something more? People are still here and I'm sure even few words of wisdom from you are like, pearls of wisdom. If you want to share anything else.
I would like to tell to the even for the diplomas who are there.
Yeah.
So you have the opportunity, especially in abroad, especially in Middle East and all, in MNC companies are there, opportunities are. And getting into the hospital, because if you go to abroad, you all are called as a patient care or mostly it will be like a machines care and everything will be there. So
Yes.
there are some related to the ethical matter in abroad. They want a registration and license and everything. So that's made a lot of, even for a bachelor's also, this is the same. Whether you are, so the thing is, in Indian scenario, you will have a very good option. Even one, maybe in 10 years ago, when I was there in attending the government meeting, even they told we should not put injections for the patients. We are not supposed to give a deltoid or even a gluteal matter. You should not give that injection.
Yes.
But when I was there in the ministry meeting, I told that we are cannulating, we can do this thing. Why we should not do those
Yes,
things?
I know.
Then,
Such big needles we are putting.
yeah. So I told them I am a certified advanced cardiac life support license. I have the license where I can able to handle the emergency drug. Why can't I able to give a drugs for the basic IM and subcutaneous? So everyone should add a value for whenever you get a BLS or ACLS, you have to upgrade yourself and more confident on your emergency practice and everything. And especially if you are very much interested to be administrator for a MBA, hospital management, get a more knowledge, do a legal. There are multiple courses there. Many people ask, if I learn, if I get a more salary. No, if you learn, you will get a value added. That's it. How you get a value? Based on your qualification.
Correct.
And based after qualification, I'm not getting a salary, don't say. Because you have to prove yourself every time. So to come into this particular position, how many times I got rejected in multiple places? I was rejected by the Quality Council of India. They said, you are a dialysis fellow. Why you want to come to the Quality Council of India? Then I proved myself, I am a master's in TQM. I know more than you are a BE fellow, engineering fellow. Then they approved my QC and I became a member of the Quality Council of India. Multiple times they never allowed me to any position.
Correct.
Even sometime, so you have to make yourself more confident.
Yeah.
Confident. That's it.
I would like to hear something from Siva Kumar or Sagar. Would you like to share some feedback? Yeah, Siva Kumar, would you like to go first? Or even Mr. Lenin has his video on. Anybody? Yes, Siva Kumar. Sorry, we are not able to hear you. Is it just me or? No, I don't know. Mr. Ragi, can you hear him?
No,
Yeah,
we can't hear. No, we can't able to hear.
Okay. I could not hear somehow. Yeah, Mr. Arshid, please go ahead. Good morning.
Arshid, we are unable to listen your voice, please. You're not audible.
That's what even
You're not audible. Unmute yourself, please. No.
Oh, I don't know. There's something even I cannot hear.
Yeah, we
Sagar,
also
would
know.
you like to try? So great, Arshit. Thank you. Unfortunately, we are not able to hear you, but I appreciate
drop a
your
message.
raising your
Yeah,
hand. Do you have a question? Can you type in the chat box
type
if
in
you
the
have a
chat box.
question? Yeah. Sagar, would you like to say something? Okay. I guess,
Hello, I'm audible.
yes, Prince, you are available. I mean, you are audible.
Audible, please.
ओके थैंक गुड आफ्टरनून सर बहुत अच्छा आज का सेशन रहा जो भी वेबिनार मैंने फर्स्ट टाइम अटेंड किया
Okay.
और बहुत कुछ सीखने के लिए मिला जैसे सर ने बताया बहुत से सारे क्वेश्चन थे जो क्लियर हुआ और मोटिवेशन भी बहुत अच्छा हुआ कि भाई फ्यूचर में भी ग्रोथ है
Uh-huh.
तो मुझे बहुत अच्छा लगा थैंक यू सो मच
Thank
एवरीवन
you. Thank you.
Thank you. Thank you. Thank you.
Thank you. अर्षित, आप फिर से
Thank
टाइप
you.
करना चाहेंगे? Okay, I guess we can stop this meeting now.
Yeah,
I
we can wind
really
up now.
appreciate,
Yeah,
yes, I appreciate all of you being here. Thank you once again, Team NephLearn, IADT, and we will see you again. Like Amitabh Bachchan says, Shabba khair, फिर मिलेंगे, and all those things.
Thank you.
Okay.
Thank you.
Chalo, bye
Thank you,
bye.
sir.
Bye
Thank you,
everyone.
Thiagarajan, sir. Thank you. Thank you.
Bye bye.
Thank you, sir. Thanks.